Healthcare has evolved over time, starting from back in the Civil War era during the 1860s. The Civil War was fought, claimed the Union Army Surgeon General, at the end of the medical Middle Ages. Little was known about what caused disease, how to stop it from spreading, or how to cure it. Surgical techniques ranged from barbaric to barely competent. The Civil War soldiers' chances of not surviving the war was about 1 in 4. These fallen men were cared for by a woefully underqualified, understaffed, and undersupplied medical corps. While against incredible odds, however, the medical corps increased in size, improved its techniques, and gained a greater understanding of medicine and disease every year the war was fought. Hospital and medical expenses policies were introduced in the first half of the 20th century. During the 1920s, individual hospitals began offering services to individuals on a prepaid basis, eventually leading to the development of Blue Cross organizations in the 1930s. Over the years, many acts have been passed supporting healthcare, specifically the Medicare and Medicaid programs signed by President Lyndon B. Johnson in the 1960s. While it has helped millions of people around the U.S., these have done nothing to help the healthcare system and have really put healthcare in the United States at a great risk to collapse. What's wrong with American healthcare? Personally, I'm almost totally disillusioned with our so-called healthcare system, which isn't a system at all, but a patchwork of insurance companies, big healthcare corporations, disconnected provider organizations, and monolithic charity operations, all with their own goals and all looking for healthcare dollars. Lots of our hard-earned money is poured into these institutions, which are supposed to provide us with healthcare, but mostly it provides them with profit and us with an insecure, inefficient, and frequently ineffective means of receiving healthcare services. So let's start with insurance. Why is insurance used as a mechanism for paying for healthcare? It doesn't work. Insurance works only when the object or event against which we have insurance is something that is not likely to happen. Insurance against a flood, or someone slipping on your front sidewalk, or some other unlikely event means the insurance company can take in more than it pays out without much trouble. But everyone needs healthcare services from time to time, some much more than others. Insurance companies have responded to this by trying to eliminate anyone who might be very expensive, and that makes sense for them, but does not serve the societal goal of making sure everyone has access to the health care they really need. Then there's the matter of our poor health outcomes compared to other industrialized nations. A report by the Robert Wood Johnson Foundation and the Urban Institute looked at 19 developed countries and how well their healthcare systems kept people from preventable deaths through providing necessary treatments. The U.S. ranked dead last. Not surprising for a country where the people with a right to health care are prisoners. The rest of us have to have an insurance card to get in the door, then we still have to hope our expensive insurance will actually pay for our treatment. The only group of Americans who rank higher than average in life expectancy are Americans over the age of 65. That may well be because if you reach that age, you have Medicare and are no longer dependent on your private insurance for your health care.
In 2010, Congress passed into law a health reform bill supported by the Obama administration, or Obamacare. President Obama campaigned on healthcare reform, and as president, he pushed a bill that would keep insurance companies in charge and require all Americans to purchase health insurance, known as the individual mandate. In its final state, it was going to consist of small state-run plans that operate like private insurance and would only be able to be available to people who only have a plan at work. When we end up with this continued reliance on health insurance companies for our access to health care, but now we are forcing everyone to buy insurance from for-profit companies that have failed to get the job done in the past. In fact, this Reform Act does not provide any kind of health care security. People who supposedly can afford the premiums may find themselves in situations to where they cannot continue paying. Their punishment for failing to send money each month to the profit-hungry insurance companies will be a fine and, of course, loss of access to healthcare. How is it that if for decades we have a pretty straightforward tool for keeping patients, and especially low-income patients, healthy, that we didn't use it? If we know what it takes to have a healthcare system rather than a sick care system, why don't we just do it? These questions, in my mind, are not hard because the answers are complicated. They are hard because they require that we be honest with ourselves. My belief is that it is almost too painful to articulate our aspirations for our healthcare system, or even admit that we have any at all. Because if we did, they would be so removed from our current reality, but that doesn't change my belief of all of us. Deep inside, here in this room, share a similar set of desires. that if we are honest with ourselves and listen quietly, that we all harbor one fiercely held aspiration for our healthcare, that it keeps us healthy. I believe that we all have a vision for healthcare in this country. I believe that at the end of the day, when we measure our healthcare, it will not be by the diseases cured, but by the diseases prevented. It will not be by the excellence of our technologies or the sophistication of our specialists, but by how rarely we needed them. And most of all, I believe that when we measure our healthcare, it will be not by what the system was, but by the system we chose it to be. On a final note, we have a question for you. What role do you think the government should play in providing citizens with healthcare?